Earlier this year, Governor Ron DeSantis signed a slate of legislation targeting the LGBTQ plus community, including gender identities in schools and drag performances. Mental health concerns are once again at the forefront as more anti-LGBTQ plus bills circulate nationwide. Bridget is standing by to talk about the effects now in today's Ask a Doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
So, new research has shown that minority youth who identify as LGBTQ and live in states with LGBTQ restrictions are experiencing higher risk of depression. Licensed mental health counselor Shantala Boss joins me now to talk more about this. And we talked before the show, and it really is a complicated issue. And what are you seeing in your office right now surrounding, how these issues are affecting youth who identify in the LGBTQ community?
I'm seeing a lot of anxiety. They're hearing things from parents, friends, peers, and so there's a lot of information coming towards them, and so it's creating a lot of anxiety, which they already had because of what they're dealing with as a young person in this minority group.
And let's talk about that, because when you look at the LGBTQ community, especially when you're a young person who may have questions about it or need to talk to someone, as you're growing up, and then you add in being a minority, that's a lot of stigmas stacked up together.
It is, and it really prevents, I think, kids and youth from seeking help sometimes, especially when it's an additional minority group on top of LGBTQ, because there is concern about being judged, or oftentimes people look for others that are like them, and so it might be harder to find a counselor that is in the same group. So it's the limited resources make it hard. So I really just want to encourage everyone to kind of try, number one, to understand where this community is coming from and what they're dealing with, because they've always dealt with depression and anxiety due to bullying and stigma, but now even more so with so much going on in the news and with all the legislation.
And to be clear, this study that was done, the research that they measured, there were like 9 categories, and 2 of those categories included, don't say gay, as well as more restrictions around LGBTQ inside of, workplaces or schools. So how do we support people who are dealing with these issues, yet maybe living in places that have these restrictions now?
Well, like we were talking about earlier, I really think that the main thing is trying to look at it from their perspective. Before we put our views or our thoughts onto them, letting them talk to us and tell us how they're impacted before we make any assumptions. And then, especially for schools where kids maybe feel like they can't talk about these things, or their parents will get notified or they'll get in trouble, seeking out mental health assistance, for any child or teenager that's watching and needs someone to talk to, it's important that they seek out a mental health counselor at their school. Technically, those are licensed clinicians, not the guidance counselors, and technically they are mandated to keep things private unless a person is in danger physically. So those things they should be able to talk about, and then possibly maybe be referred out to a mental health counselor that they can see more often outside of the school. I think it's very important that our youth know we have those resources, because it can be very alienating.
And so when you feel like you maybe can't talk to somebody, but you need to talk to somebody, how do we look for signs in terms of, someone may be struggling with their mental health?
Well, withdrawal, not answering questions. A lot of times youth will say, I'm fine, I'm okay. Attitude, anger. A lot of times when we feel sad or upset, especially as a child, they don't know how to express that. And so they'll show rebellion, breaking rules. Anything in a change in their behavior is really important that we encourage them to talk to somebody, and they may not always feel safe doing that at home either.
And when it comes to finding someone, we have a shortage right now in counselors and therapists. So how can we sort of, counteract that right now?
Well, I think it's really important that if we find out that our children or someone we know is struggling and is dealing with these issues, that they immediately seek a therapist and just have an ongoing relationship with somebody, because it's so important. They're at risk because of so many changes, so much going on. So having that person, even if they're not necessarily going through high levels of crisis, I think is super important. And those things can be sought out through insurance plans, Psychology Today. So we need to kind of maybe help link them now before there is a crisis, so they have an outlet. I think that's highly important, because you're right, there is a shortage.
Do you see it getting worse as far as, more youth maybe needing more attention when it comes to mental health care?
I do. I think there are a lot of them are also misinformed and they don't have enough support, or they're seeking information outside, maybe being on websites they're not allowed, and they're getting information and they're getting anxiety and not able to talk to their parents because maybe their parents have a stigma. So there's a lot going on, and it's so important that their parents let them know you can talk to someone else, you have an outlet, because we do not want any rise in depression, anxiety, suicide. That's already been an issue in the past, so now with all this stuff going on, it makes it harder.
And so if your child is struggling, seeking out information, you talked about some safe places to go and safe places to even look online for resources.
Well, there are safe places within schools. There are rooms that you can go. Of course, you can talk to the guidance counselor, but there are licensed clinicians on site now. That has changed, so every school does have one. So that's the best place to try to make an appointment and go talk to somebody and seek out that support.
And reputable websites as well, because there's some information out there that may not be accurate. So what are some of the reputable websites when it comes to psychology and counseling resources?
Psychology Today is great because you can look for the area you're in, specialties for minority groups, also what your insurance takes, or you can call your insurance plan and get a list, and those are reputable sources as well.
Awesome. Well, thank you for all you do. Thanks for stopping by, Shantala.
Thanks for having me.
All right, back to you, Julie.